to fit your schedule, your lifestyle, and what matters most to you whenever you can. Complete admissions by January 9th. Visit cwi.edu/bemighty.
Tonight is the McPherson's big dinner party. Today was the coldest day of the year. And surprise, the furnace is broken. Due to high call volume, it's going to be Thursday before the furnace gets fixed. Maintaining your heating system can prevent breakdowns like these. This year, plan ahead and call Western Heating and Air.
Western Heating and Air. The experts you can trust.
Carrier, turn to the experts.
It's a Idaho tailgate party. Up to $20,000 off Dennis Dillon GMC trucks. Terrain's $199 a month. Acadia's $299 a month. Dennis Dillon GMC. Exit 52, Boise.
You know, not everyone sees you when you're on two wheels, so stay alert and always keep your eyes on the path ahead. If you've been hurt by the carelessness of others, choose the law firm that will go the distance to get you the settlement you deserve. Craig Swap and Associates, one call, that's all.
That's good advice.
Watch this.
We've celebrated several holidays since the start of the pandemic, and following every one, we've seen a correlating spike in coronavirus cases. Central District Health says they have a simple solution to that. The problem? Getting people to cooperate. And it's not just the big holiday parties that have been the cause of aggressive community spread. What started as an innocent family get-together quickly turned into quarantines and hospital trips for one Caldwell family. It's a year for perspective, for sure. And it's the season we ask ourselves, what are you thankful for? Sure, some things have changed over time, but the big ones haven't. Studying and following the science has been the backbone of our approach to the coronavirus pandemic. A lot of that research has been done by incredible scientists who track coronavirus data and trends. Major goal of which, crunching all of these numbers together, creating guidance based on patterns and information to save lives. For example, why do medical experts tell us to wear a mask? To save lives. Why do medical experts tell us we can't get together in groups at our favorite places? To save lives. Yes, there's a lot of data trends and information out there, some of which are hard for the general public to access or even understand. A very simple trend to follow, though, is the spike in cases after major holidays. It's a trend that has existed all year. The difference now, however, the stakes are much higher. Joe Parris spoke with Central District Health to illustrate the spikes in numbers and to get their simple solution for stopping them.
Throughout the year, an easy-to-see COVID trend has continued. Following major holidays, COVID cases in Idaho begin to spike within 14 days. Back in May, there was fear that the trend would begin with Memorial Day, followed by the 4th of July. The data was soon clear.
So the two of those together, we saw similar activity that was happening, and it just kept inching up. And of course, in July, we really hit that high point where we were nervous what was going to happen.
Brandon Atkins with Central District Health says the expected outcome happened. In the 14 days following the 4th of July, Idaho saw record numbers, with July 15th setting the all-time high for daily case count up to that point. Community spread through the summer made it tough to control the virus, but August into early September actually saw case counts begin to trend downward. The trend began to change in early September, though, with the next major holiday.
And then we get into Labor Day and Halloween, and it hasn't changed. We just continue to see it go up.
The common denominator of holidays creating new case spikes and community spread is very easy to explain.
It's clear that those smaller group facilitated activities where people are getting together thinking it's okay, we don't really have to worry too much if we're just together as our family and friends. It's unfortunate, but because of the level of community transmission, those are some of the highest hotspots for people to be in.
Just like the 2-week period after 4th of July, the 2-week period following Halloween saw Idaho set a record for daily case count. The major difference, though, according to state data, is the high in July was 688 new cases. November's high was 1,693 new cases, a difference of close to 1,000.
We see it happening over and over and over again. people are just going about their lives, doing normal activities and not acting like there's anything to really be thinking about. And that's the behavior that we're trying to discourage, that we can't continue those normal activities and behaviors and expect anything that's going to result in a change in direction.
So heading into Thanksgiving, health officials are imploring people to please change their behavior and avoid gatherings with people outside of their own home. With the amount of community spread and capacity level of Idaho hospitals, the stakes are very high right now.
Do not travel. You shouldn't even be going across the city in Boise to go to friends' homes. If you're not living in that home with them, the guidance really speaks pretty clearly. Don't put other people at risk. Don't put yourselves at risk. Stay in.
The state of Idaho reports that there are 835 COVID-related deaths. 80% of those deaths, people age 70 plus. The ugly truth is that if the virus continues to spread uncontrollably, and that spread continues to be boosted by holiday get-togethers, more people will die from COVID.
While that someone may not be the majority of the population, who are we to choose that because we're unwilling to do the things that could help protect those people?
All right, Joe, we got an illustration how quickly and easily this can spread coming up in just a moment. But people are trying to get around this recommendation of not gathering with people outside their family on Thanksgiving by getting a negative COVID test. Explain why that's not really the best solution.
Well, a COVID test is really just a specific look at a specific point in time. You could test negative when you go into a clinic, and you could be feeling great leaving, thinking that you're good to go. But it's also possible that you don't have enough of the virus in your body to trigger a positive test, or that you could actually get COVID leaving the clinic or getting to your car. So the idea that you would be safe based on one test is flawed. Medical experts are really asking people to stay with their own family units, not go to friends' houses, not go to families' houses. Again, as we illustrated with the data, Brian, there's been these big spikes after every major holiday, and with the amount of people that are already sick in our community now, it could further complicate things on Thanksgiving. A month later, of course, is Christmas.
Unfortunately, we hear too many people saying, I don't care, it's Thanksgiving, I'm going to do what I want. Thanks, Joe. But the proof is there, as you mentioned. We see spikes in COVID cases directly after and related to holiday get-togethers. It's there in the data and in the anecdotes. Like this story from a family in Caldwell. Melanie Jones's mom, she came over to her house on Halloween. She didn't think anything of it. Everything seemed fine. Then that night, Melanie's mom started running a fever. Melanie says both her mom and her dad tested positive for COVID-19 2 days later. And not long after, everyone in Melanie's house came down with it. Her, all three of her kids, aged 17 to 11, and her husband, Zane. Then a week later, Melanie says, she had to drive Zane, who is 57, diabetic and asthmatic, to West Valley Medical Center in Caldwell.
And so when we got into the hospital, they wouldn't let me in because I had tested positive. And so they had Zane there. And then I got told I had to wait. They had me wait in the parking lot. And then I got told that they were keeping him.
When they told you that they were keeping Zane at the hospital, how concerned were you?
I was really concerned because he was really, really sick. And when the doctor called and said, as bad as this thing is, that is where Zane is at.
What's it been like for you then these last 5 days, knowing your husband's been on a ventilator in an ICU and you haven't been able to visit him?
It's been really hard. The kids and I have cried and we are worried and it's sad.
Yesterday he was taken off the ventilator.
Yes, he was extubated yesterday, which is really good news.
Explain the emotions that went along with that.
That was really exciting. We were shouting just a lot of cheers. Yeah, it was joy, and they were crying tears of joy at the hospital that Zane was being extubated. They were crying, and I was on the phone with the nurse and crying, and we were crying together. You know, the nurse, she had said he's one of the lucky ones because so many times that, you know, they're not making it.
You said you know how you got this.
Yeah, my dad had been sick. He had been sick and we weren't told. And so when my mom came over on Halloween Day and she was okay, she, you know, so But then she, when I talked to her that night, she was running a fever. And so the next week, they went in and had gotten tested, and it came back positive. And it doesn't take long for this virus to sink into your body. It does not take long at all. With Halloween being the 31st, by the 3rd and the 4th of Wednesday, we were sick.
We've gotten past the large gatherings, people in large numbers in tight places. That's not necessarily where this is coming from. It's coming from these small kind of get-togethers with family, right?
Right. Yeah. And it only takes one person. It only takes one person for everyone to get sick and to pass it on. So, and that's what I think everyone needs to be really, really cautious of. Zane is spending his birthday in the hospital. Zane will probably be in there for Thanksgiving. So we're not even celebrating Thanksgiving.
I assume with your mom coming over, you probably weren't wearing a mask because I'm guessing, right? Or were you?
No, because we were in our home, but every time, we had to make sure that the kids weren't going into the stores, and we were using Walmart to do pickup. So, like I said, it only takes one person entering your home or whatever, or you walking into somewhere and thinking that you're safe and you're not.
Melanie emphasizes they were doing everything they thought they should be doing to keep their family safe, and COVID still came to them. She says she and her 11-year-old daughter Molly are getting better. Emma, who you heard coughing there in the video, she's 17 and also asthmatic. She's still struggling a little bit, but is on steroids to help with that. And her son Zach, who is 12, started getting sick this past weekend and has lost his sense of taste and smell. And while they still haven't been able to visit their father in the hospital, they did speak with him yesterday over the phone. The good news, doctors believe Zane has cleared the biggest hurdle by being taken off that ventilator. But they still don't know a timeline for him coming home. And yes, Melanie's mom feels terrible for unknowingly bringing this virus into her house, which is why health experts are urging everyone to keep the holiday celebrations contained this season to just those in your own house. So maybe we can start to get a better containment on the coronavirus. Well, if you are planning on welcoming in and rolling out a big Thanksgiving meal to those not living in your house next week, it's been suggested you do this though while at least wearing a mask, right? That's the case no matter where you live in Idaho. Lately, we've been watching mask mandates pop up a bit more across the Gem State, so we thought it would be a good idea if maybe you still plan on driving to see family in another part of the state, what you can expect when it comes to covering your face. It's hard to find a place in Idaho that isn't in the red risk category when it comes to community spread of COVID-19, which is why we're starting to see more places where masks are mandatory. Let's start way up north, where the Panhandle Health District Board voted 4-2 yesterday to reinstate a mask mandate for all 5 of their counties. Before, it was just Kootenai County, but they canceled that last month. So Coeur d'Alene installed its own city standard instead. The cities of Kellogg and Moscow did their own back in July, and Lewiston, decided a day ago to follow suit. In the east, Fremont and Madison counties have had mandates since September. Driggs since July, despite Teton County canceling their countywide guideline, and Pocatello just joined the face-covering faction on Thursday. Moving westward, Valley County has had a mandate since August 11th, Blaine County since October, and Ada County, the state's largest, since July, with Boise adding enforcement starting Monday. All told, 10 counties across Idaho and several cities require you to wear a mask when you can't keep your distance. Well, so it seems we have most of the major metropolitan areas of the state covered by face covering codes. Not included in that, though, Canyon or Twin Falls counties. Of course, traveling, not recommended right now by the CDC and even our own health experts, whether it's across the country for the holidays or just across town. But if you are still willing to take that trip and that risk, Georgia Tech released a risk assessment map that you can find on our website right now at KTVB.com. The map is an estimated chance from 0 to 100% that at least one person will contract COVID-19 at your event. What you're looking at right now is the risk assessment statewide for an event with 10 people. And even then, according to this map, most of Idaho still runs a 25 to 50% chance that at least one of the 10 will contract COVID. The counties in that range include Ada County, Canyon County, Twin Falls, Kootenai, Latah, Bannock, Bonneville, and Madison, which pretty much means all of Idaho's biggest cities. The county with the highest percentage right now is Nez Perce with a 51% chance. The lowest, Camas County, with just 1% chance. Now take a look at our region. Still looking at a group size of 10 here. You can see Oregon, Washington, California all run at a lower risk level than we do. If you're headed to Utah or Colorado, those states run a similar risk level to Idaho. Montana, Wyoming both show a slightly higher risk with Idaho, and you want to bounce around the country virtually. If you want to do that, you can do that. You can see what real risk is out there. Just find this map right now on our website at ktvb.com. The question is a simple one, but time and a global pandemic can tend to complicate things. However, things we're thankful for don't seem to deviate much from 5 years ago. One other thing that doesn't change? We want to hear what you have to say. Text us about anything. Questions, comments, complaints, conundrums. Send it to us. 208-321-5614. Include your name and the hashtag #the208. We're going to share some of them at the end of the show, and you know what? Spelling doesn't even matter anymore. All right, with Thanksgiving coming up next week, there is an opportunity to put all the craziness of the past year into perspective by asking one simple question. What are you thankful for? Now, normally, we'd pose this question to people face to face, but the pandemic pushed all of that close contact communication for us in the news business, well, pretty much into a roadside ditch. 5 years ago, though, we were able to inquire about what people appreciated most at a pretty busy Boise Towne Square Mall. Now keep in mind, some of the answers you're about to hear in this 208 redial may not apply in 2020 because I believe this year some of our perspectives have changed. Then again, maybe they haven't. Right there, that works. How's it going? Good. You guys want to have a seat? What's your name?
Kiana.
Did you see the sign? What does it say?
What are you thankful for?
Hi, Owen. I'm Brian.
Hello.
Nice to meet you. Well, what are you thankful for?
Thankful to have a roof over my head and food on my plate and friends and softball.
What are you thankful for?
Taekwondo.
You know, I'm thankful for everything, honestly. I'm thankful for good health. I'm thankful for the beautiful snow. I'm thankful for a job.
I'm thankful for my family and my friends and life.
What are you guys thankful for?
My dog.
Your dog? What's your dog's name?
Butter.
Butter?
She's a yellow lab.
What are you doing?
I'm drinking barks.
What are you thankful for Thanksgiving?
Family, friends, cousins, and food.
And food? What kind of food?
Lasagna.
Did you see my sign? What's it say?
What are you thankful for? Can I say what I'm thankful for?
Please.
Okay. I am thankful for my family, friends, and my health.
I am very thankful for the ability to afford a plane ticket to come home and not have to be in a situation where I can't do it if I want to.
What could you be thankful for in yourself? Like, look at yourself and see what you're thankful for, not stuff around you, inside of you.
You guys want to answer a couple questions?
Dr. Ronald Jutsi is my doctor, my friend, and he saved my life, and I'm thankful for him.
Thanksgiving would probably be one of my favorite. I just wanted to thank my dad for working so hard and giving us money to live.
Does he like driving trucks?
No. He says it makes a living, so that's his thing on life.
My girls are still whimsical, so for me right now, that's a pretty big sweet spot. I know it's not going to last forever, and so I'm thankful for that.
My family. I grew up as a lonely child on a farm at Days Creek, Oregon, and I love having people around me.
141 Infantry. Hope they're safe.
I'm thankful for them being my best friends and them here today with me.
I lost my dad to cancer 2 years ago, right before Thanksgiving, October 25th, and so just to be able to have your family around, because you never know what's going to happen. So family is definitely something to be thankful for, and that's definitely what I'm thankful for.
Sports, not really a staple on the 208, but it's Friday and we're looking for anything to get our mind off the pandemic. Tens of millions of Americans play fantasy football, and if this season hasn't been without enough challenges when it comes to setting your starting lineup, what's happening this weekend has certainly added to it. It's not official quite yet, but rumor has it Taysom Hill will be the New Orleans Saints starting quarterback this Sunday when the Saints take on the Atlanta Falcons. The usual, and perennial starter Drew Brews got hurt, so next man up may be Hill. That is if head coach Sean Payton decides to go with the Pocatello native over Jameis Pick Six Winston. Jameis Winston, not really good with the football right now. Well, these rumors sent the fantasy football world into a frenzy. Why? Because the former Idaho standout, who played his high school days at Highland over in eastern Idaho, is more than just a quarterback. In fact, He does a lot of things on the football field. How about some of his old footage here? These are his days at Highland, sent to us from our sister station in Pocatello. In the NFL, Taysom has taken snaps at quarterback before, but the Saints have also lined him up as a wide receiver and as a tight end. He's even returned a kick or two. So is he a quarterback, a tight end, or wide receiver? This is a great video, by the way. Well, it all depends on who you ask. According to ESPN, he's both a tight end and a quarterback, but NFL.com listing him as just a quarterback. So that means if you play on ESPN, Hill could be your starting tight end this week, even though he's playing quarterback. But if you play on NFL.com or Yahoo Sports, he can only be your quarterback. And for those of you that don't play fantasy football, well, then this has about as much relevance as which fork to use first for a formal Thanksgiving dinner. And in either case, you probably don't give a fork. But let me leave you with this appetizing appetizer. Atlanta's offensive coordinator, the man who calls all the plays for the Falcons offense, Dirk Koetter. Yes, that Dirk Koetter, the former Boise State Bronco head coach from the early aughts, who is also from Pocatello, and yes, he also went to Highland High. Yay, sports.
Well, the day here was 46 degrees for the high, most of the temperatures in the 40s, and it's going to cool down a bit more as we look at tomorrow. If you look at the 7-day forecast, 41 is the high tomorrow. Sunday, 42, lows in the 20s. Both days has sunshine, though, so you have a sunny, cool weekend. Winds not too much, but it could still add to a wind chill, maybe dropping the temperature about 4 or 5 degrees. There could be a few showers the first part of next week, but they're more isolated to scattered. We're going to be back with more in just a moment.
All right, let's wrap up this Friday with a look at some of your comments you sent in during the show. This one from Daryl. Sorry to hear about the family all got COVID. You didn't seem to mention risk factors that may have applied to the family. How's that objective journalism? Well, Daryl, actually, I did tell the whole story. Zane, the father, asthmatic, also diabetic. Daughter also has asthma. But however, if you're alluding to the fact that, well, no wonder they got COVID, well, you're in the wrong lane on that one, Daryl. Doesn't really matter. The rest of the nation is looking at Idaho and our increased numbers and lack of action, and we should be ashamed. It's not a political or freedom issue, and we need to stop making it one. It's the patriotic thing to do. Wear a mask. We only need one turkey at the table this year, not multiple non-mask wearing turkeys. So says Blair and Eagle. Have a good weekend.